If you are on Social Security and disability benefits, listen up. I have breaking news regarding the March 2025 Social Security payment schedule. When are your Social Security retirement, disability benefit, SSI, and SSDI payments going to hit your bank accounts? I have all the details ready to go. And I have big news about stimulus. President Trump has announced that he's going to send $5,000 stimulus. I have all the updates on this breaking news that is coming out of the DOGE program. And stay till the end of this video because President Trump has 5 proposals that Republicans in Congress are putting in front of him to reform Social Security. This is going to impact all the 72 million people that are currently receiving benefits. I have done the research. I have all the details for you. If you're new here, hit the like button, hit the subscribe button, because all we do is bring you the latest news and updates, anything in and out of Congress that's going to affect your Social Security, disability, food stamps, Medicare, and Medicaid benefits. Now, let me know where you're watching from. As always, before I start my broadcast, I want to know what city and state you're from. So hit me in the comments. Let me know where you're watching this broadcast right now. So the first round of Social Security payments are about to go out. Checks up to $5,108 are headed out soon. Who is going to receive what? Now, let's talk about the maximum Social Security benefit. Right now, it is at $5,108. It means that if you've paid the maximum into the Social Security program, you are going to get $5,100. And benefits, of course, vary based on individual circumstances. So let's look at how your age and your current circumstances affect your benefit amount. To get the maximum benefit, you should have paid the maximum into the system until age 70 years old. That is when you are claiming benefits. Now, the full retirement age, if you are claiming benefits this year at your full retirement age, the maximum benefit you can get is growing, is increasing from $3,822 to $4,018. That's for 2025. Now, not everybody retires at their full retirement age. So if you're claiming benefits early at 62, then the maximum benefit you can get from the Social Security Administration is $2,710. So now that you know how much is coming out, what the benefits amounts are, and what the maximum benefits are, what is the average Social Security benefit? Well, it is $1,925 as of November 2024. So let's get into the details. Now, you may not know this, but the full retirement age went up again in 2025 by 2 months. So if you were born in 1959 and later, your full retirement age as of 2025 is 66 years and 10 months. And then next year, 2026, the full retirement age is going to hit 67 and is going to stay there. But they are even talking right now in Congress of increasing the full retirement age to 69. Stay till the end of this video because the 5 proposals that President Trump is considering to reform Social Security, one of them includes increasing the retirement age from 67 to 69. So stay tuned. Now, what can you expect? When can you expect your check? Well, if you're on Social Security disability insurance or Social Security retirement benefits, your due date when your check hits your bank account depends on your birthday and when it falls on the schedule. So if your birthday is between the 1st and the 10th of the month, you are usually paid on the second Wednesday of the month. If your birthday is between the 11th and the 20th, you are paid on the third Wednesday of the month. And your birthday is between the 21st and the 31st, you are paid on the fourth Wednesday of the month. What about SSI? If you're on supplemental security income, your Social Security benefits are paid on the first of the month unless it falls on a weekend or a holiday. But then there's a whole category of people who receive their benefits on the third of the month. Yesterday was the third of the month, so you should have received your benefit if you live outside the United States, if you receive both Social Security and supplemental security income, if your states pay for your Medicare premiums, and you filed for Social Security benefits before 1997. So what does this translate into actual dates? Well, Your payments are going to hit your account on March the 12th if your birthday is between the 1st and the 10th. And then March the 19th if your birthday is between the 11th and the 20th of the month. And March 26th if your birthday is between the 21st and the end of the month. What about SSI? Well, you should have received your benefits earlier than usual because the 1st of March was a Saturday, and so your benefits should have been paid on Friday, February the 28th. If you haven't received your benefit yet and you're on SSI, still to the end of this video, I will share with you what you can do about that. And then the third category of people should have received their benefits yesterday, Monday, March the 3rd. Those people include those who live outside the United States. If you are receiving Social Security and SSI, if your Medicare premiums are paid for by your state, and if you file for Social Security before 1997. So if your check did not arrive, here is what you can do. There's 3 steps you can take. The first one is that you need to wait 3 additional business days. Why is that important? Well, the Social Security Administration recommends that if your Social Security check does not come in, wait 3 business days because there may be an issue with your bank. After 3 business days, if your check does not still come in, then you need to take action. You can contact the Social Security Administration and figure out what's happening. You can call them at 1-800-772-1213, or you can schedule an appointment to go to your local office. You cannot walk in anymore. You have to schedule an appointment, or you can go online. If you have a My Social Security account online, you can find out what is happening with your Social Security benefits online. Typically, if your benefits does not come in, it is due to 1 or 2 reasons. Either your benefits have been canceled because you violated a Social Security rule, or you have an overpayment situation where Social Security paid you more money than you were eligible for, and they are holding your benefits to pay back the excess money you received until it is all paid back. So call Social Security and find out what is happening with your benefits if you did not receive your benefits. Now, let's talk about stimulus from DOGE. This is big news, breaking news, and I've been getting questions about it. People want to know, are seniors eligible? Are people who are on disability benefits eligible? And how about people who do not file federal taxes? Are they eligible for this DOGE stimulus? Let's get into it. But before we do that, let's talk about a critical update on Medicare. There is a critical window right now that ends March 31st that you can switch to a better Medicare plan. Why is that important? Well, stay to the end. I'm going to tell you. But here's the deal. 90% of all seniors are in the wrong Medicare plan. But you're going to think, why is that? How can that be? Well, it's because there are 24,000 Medicare programs, and seniors get confused about which program is right for them because there's so many programs out there. And so we've partnered with an important Medicare advisor. The service is completely free. And here's the unique thing about Chapter Medicare, whose number you see on the screen. They are the only company, the only Medicare advisory company that has access to all 24,000 Medicare plans. And this is one of the reasons why we decided to partner with them. Their advisors do not work for commission. So they're not going to get on the phone with you and sell you the most expensive plan because they want to make money off of it. Their sole mission is to put you in the right plan that aligns with your needs, your budget, and the coverage that you're looking for. And so here is what you can do right now, because there's a small window. You have to act now. Call the number on the screen, 539-205-2147, and they'll be able to help you on average save up to $1,100 per year. So the window is small. March 31st is the last time you can switch into a better plan. So make sure you contact them now. So let's talk about this stimulus. So here is Fox News confirming that Trump is talking about sending out a $5,000 stimulus check. Here is another Fox News broadcast. Here is CNN talking about Trump agreeing to send 20% of the savings that's going to be realized from the DOGE program back to the American people. And then here's Forbes talking about the same thing. So it's all over the news. So I decided to dig in. What is this $5,000 DOGE stimulus about? I have all the details. So it started when an investment firm CEO, James Fishback, proposed what he called a DOGE dividend on social media. And then Elon Musk saw that post and said he was going to check with the president. What the plan would do is that it would take 20% of the projected $2 trillion in savings from DOGE and return it to the American people. This will not happen until July 2026, when DOGE is supposed to have completed its cost-cutting mission. So now this is in motion because Elon Musk talked to Trump and then Trump went on camera. There's video out there of Trump saying that he supports this and he wants to make this happen. So now, is DOGE going to be able to save $2 trillion? Well, that is still out there because so far we've only been able to verify, according to the media, $8.6 billion. So that's a long way from $2 trillion. So if this is what they're going to do, then they have a long way to go. But here's the thing. It is roughly impossible for DOGE to cut $2 trillion from the federal budget without cutting Social Security, Medicare, and Medicaid, because those three items form 42% of the federal budget. So while we get excited about $5,000 stimulus, keep your eye out because it is practically impossible to cut $2 trillion from the federal budget if you're not going to cut defense, and if you're going to gut defense budget or stop paying the national debt and take out interest payment. There is no way to cut $2 trillion from the budget without touching Social Security, Medicare, and Medicaid. But let's get back to DOGE, because this is what the president wants to do. And so who is eligible for this stimulus? Well, only households that are net taxpayers of federal income tax will qualify for this payment. So this excludes approximately 40% of American households who do not earn enough money to pay federal taxes. Of the roughly 130 million American households, only 79 million are eligible for this DOGE payment. And it's supposed to incentivize work and make sure that people who are working and paying taxes are the ones that get the stimulus. But here is one thing that I found very disturbing about this whole DOGE proposal. It is supposed to set up a national snitch network by encouraging citizens to report each other if they think somebody is abusing benefits. So this could affect SNAP beneficiaries, Medicaid beneficiaries, and other federal assistance programs, because it's supposed to set up a system where citizens are reporting each other, and all the money that is realized from those investigation of each other are then returned to people, to the American people, as stimulus. I think it's a very, very dangerous idea because it's going to turn people on each other and frustrate people who need help. Imagine you're on Medicaid and then somebody reports you that you are abusing Medicaid. They investigate you, they don't find anything, but then you've gone through the ringer. And imagine if that is turned on nationally, where people who are on government benefits, who are legitimately in need of help, then get harassed because some people want to get stimulus checks through DOGE. I think it's a bad idea. But anyway, what are the factors at play here? When is this going to happen? Well, the Congress has to approve this bill, and it doesn't happen until July 2026. And there is other ways they can spend this money. Rather than returning it as a stimulus, maybe they should put it back into Social Security. Maybe they should put it back into Medicare. Maybe they should put it back into Medicaid. If they are saving money and realizing substantial savings from DOGE, why can't they return it into places where it's needed the most? The Social Security Trust Fund is going to run out of money in 2033. Why don't they put extra savings into that? So here's the big picture. For this to happen, Congress has to approve it. It's not going to happen until July 2026. In the meantime, DOGE is running rampant and cutting things left and right. If you like this stimulus idea, if you want them to send $5,000 stimulus, remember, if you're not paying federal taxes, you're not eligible. If you are not paying, a net taxes in your household, you're not eligible for this. So 40% of people are not going to get it. Seniors that are getting Social Security or disability benefits and don't pay taxes are not going to get it. So do you think this is a good idea? Let me know in the comments section below. And let's talk about something that I think is of more urgency than even the DOGE stimulus. So as you know, Social Security is in trouble. There's no doubt about that. 2033, benefits are going to be cut by 21% if nothing is done. It means that Congress has to figure a way to either increase the amount of money coming into the Social Security system or slow down the amount of money that's being taken out. Well, President Trump has been presented with 5 proposals to try to deal with this. Let's jump right into it. The first proposal, and I want to hear what you think about this, is to increase the Social Security retirement age. Now, Republicans want to raise the retirement age from 67 to 69. Why would they want to do that when it was just increased finally from 65 to 67? Well, there are some good reasons. The problem is that more money is being taken out of the system to pay retirement benefits than payroll taxes that are coming into the Social Security system. So there's a $200 billion deficit that needs to be addressed. If that is not fixed, and the $200 billion deficit continues every single year, by 2033, the trust fund is going to run out of money, and then benefits are going to be cut. So one way to address it is to slow down how much money is coming in. And one way to do that is to increase the retirement age. This change would affect, or it will address 20 to 30% of the projected funding shortfall. So the $20 billion, $200 billion issue, this is going to solve 30% of it. Critics point out that many people in physical labor jobs cannot work into their late 60s, making this change particularly burdensome for certain workers. The proposal would disproportionately affect lower income workers who often have shorter life expectancies and more physically demanding jobs. So let me know what you think. Do you think it's a good idea to raise the retirement age for Social Security? The second thing they want to do, the second proposal, which also slows down how much money is coming out of the Social Security system, is to slow down your cost of living adjustment every year. Now, if you've been paying attention, the cost of living adjustment this year was 2.5%. It's been going down since it hit a peak at 8.7% in 2022 due to inflation. Now they want to slow it down further. So they want to reduce the cost of living adjustment by 0.5%, and this is going to affect seniors the most. This change would address approximately 30% of the long-term funding gap, because even cost of living adjustment for Social Security is money that is coming out of the Social Security Trust Fund. So by slowing down the rate of increase, the annual increase every year, they are going to be able to slow down how much money is coming out of the system. Unlike other proposals, this would affect all beneficiaries, making it more equitable but potentially unpopular solution. The impact of reduced COLA will affect seniors the most and reduce the purchasing power of their Social Security dollars. Because here's one fact. Over the last 5 years, Social Security increases has not kept up with inflation. And so this is going to make it worse. Let me know what you think. Proposal number 3 is to increase the payroll taxes. Currently, Social Security is funded by a combined 12.4% tax between employees who pay 6.2% and employers who pay 6.2% for a total of 12.4%. This proposal will increase that 6.2% to 6.5% over 6 years, minimizing the immediate impact on workers by bringing the total Social Security tax rate from 12.4% to 13% total. This has a broad bipartisan support. 85% of Republicans supported, 88% of Democrats, which makes it politically viable solution. But here's the thing. This change will affect all wage earners and spread the burden across the entire workforce rather than targeting specific groups. Let me know what your thoughts are about this increase in the payroll tax rate. The fourth proposal, which I think is the best, is to remove the income cap. As of 2025, Social Security taxes only apply to income of up to $176,100, creating a ceiling on contributions. So anybody making $176,100 or more is not going to pay taxes on anything above $176,100. The new legislation suggests imposing Social Security taxes on earned income above $250,000. So there will be a first layer of $176,100 based on 2025 rate, and then there will be another layer of $250,000, and then the gap in the middle is called the donut hole. So if you make more than $250,000, you pay taxes on the first $176,100, and then you pay taxes on anything above $250,000. This will only affect the highest earning 4% of the population, while potentially extending Social Security program solvency for 75 years, guys. This is serious. This is why I think this is the best proposals, because not only does it bring in more money, but it extends the Social Security program by 75 years. If all they did in all the 5 proposals I'm presenting you, if all they did was this, they will increase the program's longevity by 75 years. Plus, they're going to make sure that people don't escape or people don't find other ways to avoid paying the Social Security tax. They're also going to tax investment income over $200,000. So here's an example. Let's say that top layer is increased to 400,000 and they keep the bottom layer at 176,000. Then that will bring in, for example, if somebody makes $500,000, today they will pay $10,000 in Social Security taxes. If they even increase it to 400,000 and above, that person will pay $31,000. So even if they don't do the 250 and they do 400,000 and above, they're still going to bring in a lot of money into the Social Security system, because somebody making 500,000 will pay more taxes today, 31,000, than the current 10,000 they would have paid last year. So let me know what you think about proposal number 4. And the fifth one is means testing. Means testing will evaluate income levels to determine benefit eligibility, potentially reducing benefit for higher income retirees. This approach will reduce the program shortfall by 11%. So it's not going to bring in a lot of money, but it has broad bipartisan support because 90% of Republicans supported, 94% of Democrats supported, and it will focus on the top 20% of income earners. Let me know what you think. So of all the 5 proposals, I think number 4 is the most logical, since it extends the program's longevity lifespan by 75 years. But it's going to require political coverage, and courage is not something that we know our politicians really have. And so I don't know if Congress will be willing to do that. They'll probably pick the thing that affects the low income population the most. So stay tuned about that. Let me know what you think in the comment section below. Let's talk in detail about Medicare for a second before we wrap up. So 90% of seniors are in the wrong Medicare plan. What can you do about it? And why is that? Well, there's a lot of things that are happening on the Medicare front that is causing a lot of people concern. 1 million people just lost coverage because insurance, hospitals drop Medicare Advantage plans. And this is causing a lot of trouble for seniors, and to the frustration, because when you think you have a particular coverage and now your insurer drops you or your doctor gets dropped from the network, this has catastrophic consequences. And here is what you can do about it. When these things happen, being part of the 90% that are in the wrong Medicare program is going to cost you money and is going to affect your health. Because on average, a couple will spend $300,000 on Medicare during their retirement. And if you don't have access to the right care that you need or the care that you thought your coverage had, it can affect your health when you need it the most. So that is why we've partnered with Chapter. I've been creating content for seniors for 14 years. I have never partnered with a Medicare plan because I wanted to make sure that if I am putting my name, associating my name to something, it is going to be the right thing for my audience. And so there are 3 reasons why I'm partnering with Chapter. Number 1 is because they are free and unbiased. Their agents do not work for commission, so they are not there to sell you the most expensive plan to make the best commission. Their sole aim is to get you into the best Medicare plan that fits your needs, fits your budget, and fits the coverage that you're looking for. And here's the good part. On average, they've saved $1,100 per year. But there's a short window that you can apply and switch to a better plan, or you have to wait all the way till the fall. And so time is of the essence. Call them on the number on the screen, 539-205-2147, or you can click in the comments. I have pinned their number and their form, or you can go into the description for this video. There is a form in there you can fill out very quickly, and then they'll reach out to you to help you find the best plan. These guys are very highly rated online by the Better Business Bureau. There's ratings online that people have reviewed them, 5-star ratings from verified users. And you can go out there and read it for yourself. Call Chapter at the number on your screen and save some money, get into the right Medicare plan, and most importantly, get out of being one of the 90% of seniors that are in the wrong Medicare plan. So that's all I have for today. I'm going to do another live tomorrow to bring you more of the latest news and updates, anything in and out of Congress that's going to affect your Social Security, Medicare, Medicaid, food stamps, and other personal finance issues that affect seniors. So if you are new to this channel, hit the like button, hit the subscribe button, and I'll see you tomorrow on my next broadcast.